and welcome to the first episode of Physio in 15. Today's subject is on knee anatomy. The knee is a synovial joint and sometimes can be called more than one thing. Sometimes it can be called the patellofemoral joint, other times it can be called the tibiofemoral joint, depending on what you're talking about when you're looking at the knee. All in all, there are three bones that make up this joint. You've got the femur, the patella, and the tibia. As the knee is a hinge joint, it only allows for certain movements. The normal flexion and extension that everybody knows about, and also the medial rotation that happens just at the end of extension. Now also this has to laterally rotate when it comes out of extension to unlock the knee. So let's look at the bones and ligaments of the knee. Let's start with the femur. The femur is the longest bone in the body, and it's also the most proximal part of the knee joint. Now at the distal end of the femur, there are two articulating surfaces. These two articulating surfaces of the femur are convex, and they meet with the concave articulating surfaces which are at the proximal part of the tibia. The surfaces of these bones are coated in hyaline cartilage. This allows the bones to have less friction as they move, and also protects the bones from any damage. In between the convex and concave articulations of the femur and the tibia lies a figure of 8 shaped cartilage called the meniscus. The meniscus is tough and rubber-like and acts like a shock absorber. It protects the distal end of the femur and the proximal end of the tibia. So that's what makes the joint resilient to impact. But what makes it stable? In the knee there are 4 main ligaments: the anterior cruciate ligament, the posterior cruciate ligament, the medial collateral ligament, and the lateral collateral ligament. The ACL stops forward translation of the tibia on the femur. The PCL stops backwards translation of the tibia on the femur. The LCL limits varus movements of the knee, and the MCL limits valgus movements of the knee. To aid in the joint's movement, the joint is covered in a capsule called the synovial membrane, and inside there is a slippery fluid called synovial fluid. This synovial fluid helps lubricate the joint, allowing the joint to move more freely, and allows those slippery surfaces by the hyaline cartilage to glide better. So how does the joint move? Well, I'm sure you've heard of the quads and hamstrings. However, there's more to that. The quads can split into 4 different muscles. You've got vastus lateralis, vastus medialis, vastus intermedialis, and rectus femoris. The 4 muscles of the quads extend the knee, with the exception of rec fem, which actually has another action that flexes the hip. As for the hamstrings, there are 3: semimembranosus, semitendinosus, and biceps femoris. Semitendinosus and semimembranosus are both more on the medial side at the back of the leg, and biceps femoris is on the lateral side of the leg at the back. Semimembranosus and semitendinosus extend the hip, flex the knee, and immediately rotates the lower leg when the knee is bent. Biceps femoris bends the knee and laterally rotates the lower leg when the knee is bent. Both the quads and the hamstrings play an important role when it comes to running, jumping, or walking. They work as opposites, so while one is working, called the agonist, the other one is relaxing, the antagonist. So what about bursa? Where are they? Bursa are small, fluid-filled sacs filled with synovial fluid. They sit between 2 surfaces, usually around muscle and bone, and they reduce the friction, a bit like a ball bearing. Some common bursa of the knee joint are subcutaneous superficial infrapatellar bursa, deep infrapatellar bursa, and there is also an infrapatellar fat pad. Bursa can be subcutaneous, subtendinous, or intramuscular. So let's go back to the meniscus. These menisci deepen the tibia articulating surfaces and enhance the congruency around the joint. The menisci facilitate transmission of load, shock absorption, lubrication, and stability of the knee joint. On the peripheral edges of each meniscus, deep fibers are attached, securing the meniscus to the edge of the tibial condyles. These fibers are called the coronary ligaments. These ligaments are very strong fibers, but give just enough laxity to allow axial rotation at the meniscotibial surface. So let's go back to the meniscus. Now you may think the lateral and the medial sides are exactly the same size. However, the medial side is larger, it's almost semicircular in shape, and it partly attaches to the MCL, forming part of a fibrous capsule. Lateral meniscus is almost circular and almost apart from the capsule. This is because it is also attached to the tendon of popliteus. Posteriorly, the lateral meniscus contributes a ligamentous slip to the PCL, known as the posterior meniscofemoral ligament. So there you have it, knee anatomy in under 15 minutes. Keep an eye out for any other videos coming out soon, and subscribe so you know when the next one is out. See you soon!